Oh, yep.
Awesome.
Hello, we're group 2, and today we're going to be talking about Wernicke-Korsakoff syndrome. We'll be reviewing an evidence-based treatment plan and options available to patients with this disease. Wernicke-Korsakoff syndrome is a brain condition that's related to chronic alcohol abuse. It's a combination of Wernicke's disease, which is the early onset of the disease. It's a sudden and severe acute brain disorder associated with general degeneration due to a lack of vitamin B1. When left untreated, this progresses into Korsakoff syndrome, which is a long-term chronic memory disorder. Poor nutrition, which is a secondary symptom associated with the overconsumption of alcohol, causes less vitamin B1 available in the body system, and this increases the risk of developing the syndrome. The condition can lead to permanent brain damage and can become life-threatening, particularly to the 80% of people who live with the syndrome and go undiagnosed. In the United States, 1 to 2% of the population is affected by this disease. It's more commonly seen in men than in women and seen in age groups 30 to 70. The populations at the greatest risk are homeless, psychiatric patients, and seniors living in isolation. For our clinical scenario, a 45-year-old male patient is brought in by his daughter, who is voicing concerns about her father's recent health. She insists he has been forgetful and confused while performing regular daily tasks and activities, although he's seeming to disagree. While denying the recent confusion, he admits to experiencing involuntary limb movements, accompanied with tremors, as well as general lethargy. The patient has had a long history of alcohol use disorder and has recently experienced an unexplained loss of weight.
For the description of plan, the treatment for the patient will include some of the following aspects, which is Fogg's behavioral model to aid with this patient's diet change, MAT to help with the patient's AUD, and nudging to help implement the new behavior changes. The plan incorporates behavioral models that are systematically designed to help patients reach their goals if implemented correctly. The use of MAT will allow the patient to deal with the chemical imbalance of symptoms associated with abstinence after the chronic alcohol use. Additionally, nudging will be used to make the healthy choice the default choice. The patient would implement the social cognitive theory to address his WKS diagnosis. One important factor is the behavior modification, particularly for his diet. Self-efficacy needs to be developed in practice to continuously stay motivated and make progress. Reciprocal determinism will also help him as he needs to adapt a new routine, which is affected by behavior, people, and the environment. In Fogg's behavioral model, patients will be more successful in given smaller goals. Each success increases the likelihood of becoming more motivated. Higher motivation needed to do hard-to-do tasks. Smaller goals set up patients for success. These hard-to-do tasks have little motivation, causes patients to fall below the action line curve of where they will need to be successful, which would equal no success. Fogg's behavioral model will help patients with diet change to higher their vitamin B1 food consumption. Depending on the motivation of the patient, this can either be to choose 3 to 5 high vitamin B1 meals a week or eating a high vitamin B1 meal once a day out of the week, both along with oral supplements. This can be an individual activity or one including family, friends, or community members cooking together and sharing recipes. Some good food sources for this B1 are pork, fish, beans, lentils, green peas, sunflower seeds, yogurt, and enriched cereals, breads, or rice.
So MAT stands for the medication-assisted treatment. So with ours, the following medications can be prescribed to help a patient. The first one that we had would be, I'm going to butcher this, but it's acamprosate, and that's for people in recovery. And this helps them avoid consuming alcohol, but not helps with the withdrawal symptoms. But this takes about 5 to 8 days to work. And how that one works is it helps stabilizes the chemicals in your brain to help reduce the excess alcohol in your system. The next one would be the disulfiram, and this one treats the chronic alcoholism. And this one's most effective in people who have stopped drinking or are in early stages of abstinence and cannot be taken while consuming alcohol or within 12 hours of consuming alcohol. So abstinence can be very important with this medication. And then how that one works is it blocks the inhibitors in your brain, which cause like the rapid like alcohol levels to rise, and this will help it decrease. And the last one would be the naltrexone, and this one blocks the euphoric effects of intoxication and reduces alcohol use. It allows patients to be placed on other needed medications to stay motivated and to take medication to stay in treatment. And that one kind of, it takes away like the fun effect, I guess, that alcoholics use, or that's why they use alcohol for. These medications, along with the diet change and therapy with intervention, will make it easier for patients to reduce or practice abstinence from the alcohol use. The medications do not cure alcohol use disorder, but it also makes it easier for the patient to take the first steps for abstinence and helps to lower the risk of a relapse. As there's always a risk that a patient don't do well on these medications, a patient could be started on one and switch to another if necessary. And then with nudging, this concept of nudging will help a patient make better choices in terms of his or her behavior. And like nudging is basically making small changes in a person's life to help change their architecture of what they're normally doing. Examples would be placing vitamin B1 rich foods in front of the fridge or cabinet at eye level to encourage them to choose that kind of food choice. Printing out recipes of B1 rich meals and sticking them on the fridge, laying them on the countertop. Placing medications on the nightstand next to the phone or in the bathroom next to the toothbrush to avoid out of sight, out of mind. Using reminders on the phone to nudge a person to grab a diet appropriate snack or take medication. And then meal prepping helps allow them to eat healthier foods that are already prepared, ready to eat. So a patient that is struggling can just grab one and go, and helps motivate them to cook every day. And then those are the references we used. That's about it.
Thank you guys.